Which are the most common non-communicable diseases you see as a doctor and the primary causes amongst patients?
So, non-communicable diseases, as you said, cardiovascular, which is stroke, heart attack, diabetes, chronic pulmonary disease, which is asthma, of course, anemia, cancer, sleep disorders, fatty livers, high uric acid, all these put together form this segment of non-communicable diseases. Something that you have not caught it from your neighbor, something where you didn't get it because you forgot to wear your mask, but something which you grew into your body on your own. Unhealthy living and lifestyles, and adverse social and environmental circumstances. Those are the things that we see.
So just to narrow down a little bit, how much does lifestyle play a part in terms of non-communicable diseases and how much does genetics? Because we're also talking about diseases such as cancer here.
So genetics, the South Asian where we belong to, we have a diabetic gene. We have a cardiovascular gene. So the seed is planted at birth. However, how you nurture this seed, whether you allow it to recede in the background and you look after your lifestyle, or whether you go gung-ho on salt, sugar and butter. Salt will give you hypertension, sugar will give you the diabetes, and butter the hyperlipidemia, all of which put together will give you the apple-shaped metabolic syndrome that you alluded to. So lifestyle is how you cater to that bad gene which you can't do nothing about. So if you are able to change your lifestyle, to exercise more, to eat wisely, to shun the wrong things, to keep alcohol, tobacco at bay, and even sleep well, then you can look after the condition as a whole.
According to you then, what would be the key risk factors for probably contracting a non-communicable disease?
So I think it's unhealthy lifestyle. If you eat badly, you're only having fast food. If you're seeing that every time you want to celebrate, you don't go out anywhere but you go and hit the bar. If you're having sweets to celebrate, if you're not exercising, you're a couch potato. How many of these celebratory young people who are successful sit on their desk in front of a gigabyte screen and do nothing about walking? Even simple walking regularly 5 days a week, 30 minutes is enough to get your circulation going. So your unhealthy lifestyle, alcohol, tobacco, smoking, especially tobacco with smoking, adds on to all this. Going into a dark disco with loud music and bright lights is also environmental stress. And one of the newest additions to non-communicable diseases is Alzheimer's and dementia, which you get because of constant bombarding of your special senses with all sorts of external stimuli, which you are not programmed for, which the body doesn't want, but you still get it. The body never grew up with alcohol, tobacco, loud music, flashing lights, and excessive stimuli, like you had the BlackBerry syndrome when it came in. So moderation is extremely important. Where to draw the line between success and health, between suffering and striving, where to draw the line for your own self.
Are you seeing more NCDs with amongst younger population now as compared to earlier?
So another NCD is anemia. So we are seeing these diabetes, hypertension, anemia, fatty liver in the younger population. And all that breeds, put together, cardiovascular disease, strokes. In India, strokes outnumber heart attacks. So just imagine a person who is fully fit otherwise, but is lying paralyzed because he's had a stroke. We are seeing more and more. 6 out of 10 hospital beds, to quote you, what you said in the beginning. We are definitely seeing NCDs cripple the backbone of the economic infrastructure of this country, because it is the young, the middle-aged who are into the best productive years of their life getting handicapped because of their own doing. You're sawing the branch on which you sit. You have to decide what you're going to do about it.